Hi everyone, I am Roslyn Anita, nursing tutor in Tribulum College of Nursing. Today I am talking about the topic of abnormal pulses. Objectives: Introduction, definition of pulse, list down the purposes of pulse, enlist the pulse site, discuss the factor affecting pulse rate, list the abnormal finding in pulse, explain the abnormal findings pulse, enlist the character of pulse and its explanation. Introduction. The pulse is a wave of blood created by alternate expansion and recoil of elastic arteries. After each contraction of the left ventricle of the heart, the pulse may be felt in any arteries that lies near the surface of the body that can be compressed against a bone or other firm structure. The strength or amplitude of the pulse reflects the amount of blood ejected with myocardial contraction, that is stroke volume. The normal pulse rate range for an adult is between 60 to 100 beats per minute. Coming to definition. Pulse is the palpable bounding of the blood flow noted at various points on the body where the artery is near the surface and passes over a bone when blood is pumped into the arteries by the contraction of the left ventricles. Coming to the purpose of pulse. To establish baseline data for subsequent evaluation. To identify whether the pulse rate is within normal range. To determine whether the pulse rhythm is regular and the pulse volume is appropriate. To determine the equality of corresponding peripheral pulses on each side of the body. Coming to pulse site. There are different types of pulse site. Radial, temporal pulse site, carotid pulse, apical pulse site, brachial pulse, femoral, popliteal pulse, posterior tibial pulse, dorsalis pedis pulse. This is radial, brachial pulse, carotid pulse, femoral pulse, popliteal pulse, dorsalis pedis, posterior tibial pulse. Coming to the factors affecting pulse rate. Age, gender, exercise, fever, medication, loss of blood, stress, position changes, heart disease. Coming to the abnormal finding in pulse. Rate, rhythm, volume and character. In abnormal pulse rate, there are two based on two. One is tachycardia and bradycardia. Tachycardia, it is a rapid heartbeat more than 100 beat per minute. That is, heart rate exceeds the normal range. In bradycardia, a slow heartbeat less than 60 beat per minute. In tachycardia, there are sinus rhythm and arrhythmias. In sinus rhythm based on exercise, anxiety, phecocytoma, fever, hyperthyroidism. In coming to the arrhythmias, there is a atrial fibrillation, atrial flutter will occur and ventricular tachycardia will occur. Coming to the bradycardia, in sinus rhythm and arrhythmias, in sinus rhythm is based on sleep, athletic training and hypothyroidism. Coming to the arrhythmias, carotid sinus hypersensitivity, sick sinus syndrome and second degree heart block and complete heart block. Coming to the abnormal finding in rhythms, occasionally irregular, regularly irregular and irregularly regular. The causes of irregular pulses. Occasionally irregular, it is the extrasystole, and regular irregular, it is ectopic beat occurring at a regular interval, and second degree atrioventricular block and sinus arrhythmia. In irregular regular is based on atrial fibrillation and multiple ectopics. Coming to the pulse effect defect, that is difference in heart rate and pulse rate. In atrial fibrillation is greater than 10 per minute. In multiple ectopics, that is less than 10 per minute. That is atrial, so that is pulse apex defect. Coming to the abnormalities in pulse volume is based on 3: high volume pulse, low volume pulse and varying volume. Coming to the high volume pulse, in physiological causes, that is exercise, pregnancy, advanced age and increased environmental temperature. And coming to the pathological causes, atherosclerosis, aortic regurgitation, arteriovenous fistula, fever will have, thyrotoxis, anemia, beriberi, complete heart block and cirrhosis of liver. Coming to the low volume pulses, the causes are left ventricular failure, hypovolemia and peripheral arterial diseases, shock, severe aortic stenosis and pericardial effusions. These are the causes of low volume pulses. Coming to the varying volume, it's a combination of low, normal or high volume pulse in varying manner. It is seen in atrial fibrillation and ventricular tachycardia. And coming to the characteristic of pulse, there are different characteristic of pulse. One is collapsing pulse, slow rising pulse, pulses bifurcans, pulses parvostratus, pulses bigeminous, pulses alternans, pulses paradoxus, anachrotic pulse and dicrotic pulse. There are different characteristics of pulse. We will see in one by one. First is collapsing pulse. Collapsing pulse, this is a normal collapsing pulse and that is water hammer pulse is otherwise known as collapsing pulse. We'll see in the picture. Yes, Watson water hammer pulse is also known as Quiringer's pulse or collapsing pulse, which describes a pulse that is bounding and forceful, rapidly increasing and subsequently collapsing as if it is were the sound of a water hammer that was causing the pulse. Coming to slow rising pulse. In slow rising pulse, we can see in the second picture slow rising pulse. A slow rising pulse as a delayed upstroke and occurs in aortic stenosis. A pulse is described as bounding if it has increased upstroke and downstroke. This may be a sign of CO2 retention. Coming to the pulses bifurcans. In pulses bifurcans is a single central pulse wave with two peaks separated by a distinct mid-systolic dip. An earlier component, percussion wave, result from rapid left ventricular ejection. Coming to pulses paribus tardus. In pulses paribus tardus refer to a late, that is relative to heart contraction, weak pulse which is commonly felt during a physical examination of an individual with aortic wall stenosis. And coming to the pulsus bigeminus. In pulsus bigeminus is a cardiovascular phenomena characteristic by groups of two heartbeats close together followed by a longer pause. The second pulse is weaker than the first. Coming to the pulsus alternans. The pulsus alternans is an arterial pulse with alternating strong and weak beats. And coming to the pulsus paradoxus. In pulsus paradoxus, there is a inspiration, expiration and inspiration. We'll see in the picture. A fall of systolic blood pressure of greater than 10 mmHg during the inspiratory phase. And coming to the anachrotic pulse, this is a normal, we'll see in the picture, this is a normal pulse. And coming to the anachrotic. An anachrotic pulse, one in which the ascending limb of the tracing shows a transient drop in amplitude or a notch. Coming to the dicrotic pulse, this is a normal and dicrotic pulse. The dicrotic pulse is an abnormal carotid pulse found in conjunction with certain conditions characteristic by low cardiac output. Conclusion: pulse is the number of times heart beats per minute. Normal heart rate varies from person to person. As an age increases, changes in the rate and regularity of the pulse can change and may signify a heart condition or other condition that needs to be addressed. References: Pottenperry's Fundamental of Nursing, Volume 1, 9th edition, page number 100 to 115, and online healthline.com per health, and Abnormal Pulses and Nurses Lab. Thank you.